Hello, it's Dr. Ominde again. Just brief on the applied anatomy of the blood vessels of the lower limb. So we have what you call arteriogram. This is when vessels, the arteries, are investigated by injecting contrast or a material that can be seen on radiographs. So you put contrast in the vessels through the IV access, okay, and then you examine under radiograph. As you can see here, you can appreciate the femoral artery becoming popliteal artery and the tibial, anterior and posterior tibial. So basically, arteriogram is just to examine the course of the artery and if there's only obstruction. Then we have varicose veins. So varicose veins are elongated, dilated, and tortuous superficial vessels of the lower limb mostly, and these are caused by incompetent valves within the superficial vessels, or if the perforators are affected, therefore venous drainage is impaired, so you cannot ensure unidirectional flow against gravity back to the heart, so that leads to varicose veins. Then where do you get the arterial pulses? At the mid-inguinal point, that's where we pulsate for the femoral artery. That's the midpoint between pubic symphysis and the anterior superior iliac spine. So that's where you get your femoral artery. Then at the popliteal fossa, you get your popliteal artery pulse. And at the mid-malleolar point, towards the dorsum of the foot, that's where you palpate for the dorsalis pedis pulse. So when you at this portion, you're able to feel on the medial aspect along the tarsal tunnel, you feel the pulse for the posterior tibial. Okay, so then another applied anatomy aspect, when lymphatics accumulate within the channels and the lymphatic fluid is not able to drain sufficiently, like in this case you can see there's a problem. The lymph is swollen because of accumulated lymphatics, and this occurs in various conditions. So this is lymphedema, and it can be caused by very many factors, but just know accumulation of lymphatics because of, again, it could be impaired valves, it could be parasitic worms that affect the lymphatics, so this can lead to lower limb swelling. Okay, so we have different anastomosis within the lower limb. We have cruciate anastomosis, trochanteric, genicular, and ankle anastomosis, also the plantar anastomosis. So why do you need to understand that we have these anastomosis? Anastomosis, they just ensure good circulation of blood in case of any occlusion. So if one is occluded, you're able to have an alternative source of blood supply to still supply the distal portions of the limb. So basically, those you need to know which arteries participate in each of the anastomosis. Thank you very much.